Hello, I'm Dr. Robert Russo, Executive Director of the Connecticut State Medical Society. Welcome to On Call with Connecticut Physicians, the Medical Society's podcast initiative. Welcome to On Call with Connecticut Physicians. This is our new podcast. It's designed to help legislative people and people that make executive administrative decisions. We're going to have a series of podcasts that allow the Connecticut Medical Society to state its policies and positions on various things that will come in front of the legislature this year. We're going to start off with Dr. Gregory Shangold, our president of the State Medical Society. As a reminder, the State Medical Society represents 4,000 physicians in the state of Connecticut. Its mission is the advocacy of physicians and their patients. So the first podcast will involve surprise billing, a term manufactured by the insurance companies. And I would like to introduce Dr. Greg Shangold, who will get us up to date on this issue. Greg?
Hi, Bob. Thanks for having me here. Surprise billing, as you said, is a term created by the insurance industry. But what most people really experience is a surprise lack of coverage. And this term has been there to decrease people's access to care by creating narrow networks and ultimately putting more cost onto the patient rather than covering those costs with their insurance plans.
Doctor, could you give us a real-life example of the surprise billing in the emergency room?
Sure. A common case is acute appendicitis. So many patients present to the emergency department with abdominal pain. Part of the workup is usually to get a CAT scan. If the CAT scan eventually does show an acute appendicitis, the emergency physician will call the surgeon, the patient will go to the operating room and have the appendix removed. At that time, usually a pathologist is involved as well. And so it's really important that patients understand that doctors and the hospitals are taking care of the patient. There's no thoughts about what insurance they have or how to deal with that. All this happens after the fact. So weeks or months after that patient is released from the hospital, that's where the paperwork is done. Now, many times, some doctors are not in network for a lot of different reasons. Usually this has to do with schemes that the insurance company creates that really narrows the networks in take it or leave it type contracts. But after the fact, the patient really shouldn't be exposed to any of those discussions that need to happen when the paperwork is figured out after the fact.
I know that if a patient goes to an emergency room, they have to be treated. There's not really a choice about turning a patient away at the emergency room. Can you tell us a little bit more about that and why that's so?
An important concept was put into federal law back in the mid-1980s, and that law is called EMTALA. And its colloquial name is more of the anti-dumping law. But that means any patient that presents, regardless of their ability to pay, is seen in the emergency department. They determine if there's an emergency medical condition, and they're provided stabilization for that emergency medical condition. Whether you have insurance or don't have insurance, the emergency department is there as society's safety net. Furthermore, the hospitals, with their own call network, provide additional stabilization, such as in a trauma patient or a heart attack patient. So the on-call network of physicians that are affiliated with the hospital assist in all of the stabilization that occurs. But that means we need to collect the money after the event. And that, in order to have the right amount of doctors and the right amount of access, especially when there's uninsured patients and a significant amount of Medicaid patients that do not cover the cost of that healthcare, society has created the paradigm where those with insurance basically pay enough money to cover all the costs so that all of us have access to this high quality care as society safety net.
Yeah, I look at it as this is a problem that was basically created by the network problems. I mean, years ago, we didn't have this problem. Physicians could join various insurance companies without this problem with networks. And now that the networks are getting narrower, it's very difficult for patients and physicians for that matter. Physicians have been kind of turned into agents for an insurance company trying to interpret the rules and regulations about who's covered and who's not covered. I mean, I think that in a future podcast, we'll talk about high deductible plans, but I think this kind of catch-22 that we've got patients in with these narrow networks, and when you get out into the periphery of the major cities where there's not enough specialists and the networks are narrowed, we're seeing difficulty being able to treat patients, especially trauma patients. Where suddenly you're in a system that not everybody's in the same network and you don't know that. And the doctors at the time of treatment don't care. The doctors care about proper care and adequate care at the moment. And then the disaster hits later where the doctors and the hospitals and the patients are trying to sort out the difficulties of what's been created by the insurance company. So I think that's why this is one of our biggest legislative issues, and it's important, you mentioned it, Connecticut's doing a good job. We really don't need to do much more than we've already done, especially to move backwards like the federal law may cause. So it is an issue for us, and I appreciate you talking to us about it today, and thank you. It's necessary. Thank you all for listening to our conversation on the Connecticut State Medical Society podcast. Please use the contact information provided here for questions and more information related to the legislative activities in the 2021 session. You can listen to other episodes of On Call with Connecticut Physicians at the Connecticut State Medical Society's website, csms.org. Be sure to engage with CSMS by following us on Facebook, Twitter, and LinkedIn. We look forward to seeing you here next time.